come on in. You can take a seat. So how are you doing today?
I'm okay. Tired.
Tired.
Yeah, all right.
Okay. So have you been to therapy before?
I have. Yeah, I was in therapy for quite a few years, but it's been a couple years since I've gone.
Okay. So are you familiar with confidentiality?
I am. So to an extent,
What does that look like to you?
that if I were to say that I was going to harm myself or somebody else, then you would not keep that confidential.
Okay. Yes, so I would have to report that. And then in addition to that, I would have to report any child or elder abuse if I hear about any of that. I do have to also report that, but I would just let you know ahead of time, so I'm not going to go behind your back. So I do hope that you feel comfortable to say anything to me today and in the future.
Mm-hmm.
So you said that you did go to therapy in the past
Yeah.
for a few years.
Yeah, for many years.
Many years.
Yes, off and on, different therapists. Yeah.
And what was your experience like?
It was always pretty good. I kind of started out with one, and I feel I sort of graduated and then would pick a different one, and then I was with one for a long time, for 5 years. So they were pretty good. There was one time I was in counseling for marriage counseling, and I didn't think that counselor had enough courage
Okay.
to speak up
Mm-hmm.
to my ex-husband, but otherwise everything's been good.
Okay, awesome. So that was just your marriage counselor, but then you said you had a different counselor for 5 years. That's a long time. Sounds like you had a good therapeutic relationship.
We had a very good one. Yeah. Then she said it was time for me to go. I said, please, I'm not ready. And she said, you're ready. So we weaned my time.
That's awesome that you were able to graduate.
I graduated. Now I'm back.
So what brings you back?
So I've been experiencing post-traumatic stress disorder. 3 months ago, I was in an accident. I was thrown from a horse, and I was in the hospital, and it was pretty scary. And I had a broken leg and 2 breaks in my hand, a concussion, and I had brain hemorrhage on the outside of my brain, which is a lot better than on the inside of your brain.
Wow.
But all these things, so
that would cause some post-traumatic stress.
Yeah.
So you fell from a horse.
I was thrown from a horse. So.
Thrown from a horse.
Yeah.
Yeah.
Yeah. Yep. Yeah. So then I started waking up in the morning and feeling afraid. It's been 3 months now, and just a lot of fear when I wake up in the morning. And I now give people tools on how to work through these situations, so it's kind of extra challenging for me. Aw, cute puppy.
So, okay, so you were saying that you give people tools.
I do. I teach yoga, and I'm a life mentor. So I actually help people with tools for stress management, for being mindful, for living consciously.
Okay, well, yeah, so as professionals, it's easy to neglect our own self-care or just have a challenge with implementing the strategies that we coach other people through. It is good that you sought treatment to have somebody help you through this experience as well, because you also need that, even if you are a professional who has these tools. So, like meditation and yoga, how often are you doing those?
So I do it daily, meditation and yoga daily, pretty much. On the times when I don't do it, then it gets worse. So I do it. I would like to do it more.
Life gets busy.
Yeah.
Okay, so going back to what you said earlier, you said it's in the morning your anxiety is heightened?
When I wake up in the morning, it's heightened, and then, yeah, that's when I notice it. That then once the day gets going, sometimes things will happen again, and I just feel
Just random things that trigger your anxiety?
I don't even know. I don't even know what it is that triggers it. Just all of a sudden, I feel anxious and sometimes fearful. Yeah.
So do you think that there is a trigger, or it's just completely random?
Well, that's a good question. I don't know. I'll have to, I think, pay attention and see what happens.
That
Yeah.
could be something that we could hopefully figure out together.
Mm-hmm.
Yeah, and maybe before next week or next session, try to notice throughout the day when you feel that anxiety has been triggered or your fear is heightened, and then maybe just take a mental note or write it down, and then we could look at that next week as something to decipher about those triggers. Does that sound okay?
Yeah, it sounds good.
Okay. All right, so I'd like to go back to the accident, if you don't mind, just walking me through exactly what happened.
Sure.
If that's okay with you.
Yeah, that's fine. So I got on a horse that I don't usually ride, and my trainer recommended this horse, and well, quite frankly, a couple weeks before she recommended it, and I didn't want to ride the horse, but she talked me into it. She felt the horse would be completely fine. And then, so I got on the horse and we were walking, and she wasn't really listening that well, but she wasn't taking off. She wasn't just kind of going. So I had to push her more. And then my trainer said, "Do you want to go for a trot?" And so I said, "All right," and I gave her the message to go for a trot, and and she took off. And I knew it was going to be bad. I just felt intuitively that I had no idea what was going to happen. I wasn't sure. I knew I had no control whatsoever. So the horse took off, and I think it was a gallop, and I just remember being up high in the air, and then I don't remember anything else, and then I remember being in the barn. So during that time, I was thrown from the horse, but I was unconscious, but I was walking and talking during that. So my trainer didn't know that I was unconscious, but I don't remember anything from the time when I was up in the air and I heard my trainer say, "Sit back," until it had to be 20, 30 minutes later when I was on the way to the hospital.
Wow. So what I heard, basically, just to make sure I get everything right, that your trainer kind of brought you onto a horse that you weren't used to riding, and you weren't feeling 100% comfortable with riding it. And sounds like that trainer pushed that decision on you a little, and then
I allowed it to happen. Yeah.
So, and then from there, you just kind of felt out of control and were thrown from the horse. And then you had some amnesia. That's very traumatizing.
Yeah, and I had brain hemorrhage, a concussion, and broken bones, and so a brain injury.
And how long were you in the hospital?
3 nights.
Wow.
Yeah.
That is very deep, and there's a lot of different elements there with your emotions.
Mm-hmm.
Sorry.
Snuggle kitty cats. Counseling cats.
Yeah, counseling cats. So, this was just to get to know you and exactly what you're dealing with right now, but it does sound like you have some awesome tools of your own that you're working with at home to help yourself heal. But there are those deeper emotions that you want to talk about, and I would love to help you through what you're going through.
Okay.
If that sounds good for you, then if you said earlier that marriage counselor wasn't the greatest, so it is hard to connect sometimes. If you feel that you would like a different therapist to help you through this, then I would have no problem referring you, but I do want you to get the help that you need.
Okay.
So, I would love to see you again next week, and you can bring that homework.
Okay.
Does that sound good to you? Okay, and I would just like to see how talking about your feelings today made you feel. Did you feel a little bit better?
It's good to bring awareness to it. Yeah.
Okay, awesome. All right, well, that's it. So I will see you next week.
Okay. Nice meeting you.
Yay.